If you take pharmacology in nursing school, then you understand that it is not an easy class. That's why in this video, I'm going to give you the tips and tricks that I've used that helped me do well in nursing school, specifically with pharmacology. My name is Abby, and I'm a licensed registered nurse. I graduated with a near 4.0 GPA in my accelerated nursing program, and I've also completed and passed the NCLEX on the first try with the minimum number of questions required. I've also gotten the ideal hospital position that I've applied for. I hope that through listening to this video and watching this video that you take with you the information that I talk about and so that you're able to excel and do well in your pharmacology courses. So, one of the very first things you want to understand when it comes to pharmacology is that you want to understand the basics. This means that you want to know the basic classes of each drug. Say if you have an antibiotic or an anticoagulant or an antihypertensive. By grouping drugs into their various classes, you're going to be understand the common theme that drugs share within each class. Learning drug classifications also makes it easier for you to understand the drugs that you're studying because it can help you understand each drug's mechanism of action. And that basically means understanding the specifics of how the drug works throughout the body. In order to know and understand the mechanism of action, you may want to freshen up on your anatomy and physiology. What I mean is that because you're going to be studying the mechanism of action for each drug, it's going to require you to have a basic understanding of how each body system works. So, because of that, you may want to freshen up on your physiology if you forget how that urinary system works or how the respiratory system works in detail and how certain drugs can affect the urinary system or the respiratory system. You may also notice that when it comes to classifying drugs, that you're going to notice a pattern when it comes to looking at the names of these drugs. For example, some drugs might have the OLOL suffix at the end or the sartan suffix at the end, letting you know that, hey, these drugs are grouped and they are specifically antihypertensives. By recognizing patterns in the names of certain drugs, you're able to get a better understanding of how to classify those drugs and remember their mechanism of action and their purpose. The next thing when it comes to mastering pharmacology is to use active learning techniques. For example, flashcards are a big way that I've utilized my active learning techniques in order to do well in my pharmacology course. You can use tools such as Anki or Quizlet. When making flashcards, you can set them up so that you're recalling the specifics of the drug names, the side effects of drugs, or various other components that are relevant to the drug, its classification, or its mechanism of action. Two other additional active learning techniques include teaching somebody something about the drugs you're studying and using practice questions or question banks. Those two ways are additional ways to practice active recall because when it comes to teaching somebody information about the drugs you're studying, you're testing your own knowledge and your own understanding of what you know about each drug. The same thing can be said for when you look at question banks and practice tests. You are looking at the questions, trying to apply your knowledge in a way so that you're able to answer the questions correctly. And based on how you answer and looking at the rationales, you're able to see and gauge where your knowledge gaps are. Now, a quick thing I want to mention is that Quizlet is a website that is free for you to use. All you need to do is to sign up and start creating flashcards. You can make them in a format any way you like. You can make it such as true or false, listing side effects of drugs, answering fill in the blank questions. If you purchase the plus feature, you can even add images and diagrams to your flashcards and also notes. I find that very beneficial and helpful for me. If you're curious to learn how you can format your cards, I have a link in the description below where you can have access to my Quizlet profile for free so you can get a better idea as to how I made my flashcards in nursing school. This will benefit you, especially when it comes to certain courses such as med-surg and pharmacology. These courses are known to be the two most difficult courses in nursing school because of how complex they can be and the degree of memorization that's required. If you're curious to look at my pharmacology and med-surg Quizlet decks, I also have a link in the description below so you can get access to it. Let's get back to the video. Another thing you can do is you can utilize charts or tables to organize and categorize the information. By putting your information in charts or like in certain table formats, you're able to get a bigger bird's eye view of how drugs are grouped by their mechanism of action, by their names, by what they do in the body. You can also organize and categorize information by using mnemonics. Mnemonics are basically words or sayings that you use in order for you to help retain information easier. Color coding your notes is also another great way to categorize your information that you're learning in class. The fourth thing you need to do is utilize spaced repetition. Spaced repetition is when you study for a short period of time, then you put the study material down, and then you periodically come back to it. Each time you come back, the time between gets longer and longer. So say I study 10 flashcards for 15 minutes, I put it down, I come back in an hour, I review them again, I put them down, I come back in 5 hours, I review again, I put it down, etc., etc. So I keep doing that so that I'm able to retain the information over a period of time. I find spaced repetition to be very helpful, especially if you're using resources such as Anki or Quizlet. I know Anki is very popular for people when it comes to spaced repetition because it's automated, it's integrated into the application itself. Whereas with Quizlet, you just kind of have to remind yourself to do spaced repetition. The fifth thing you want to do in order to excel in your pharmacology course is to make the information relatable. I know I've had some friends in my classes who've done well by making it relatable by utilizing storytelling. What they do is they make stories about each drug, what the side effects of each drug does, how the drug goes throughout the body. Number 6 is to stay consistent. You can only get good at pharmacology if you're consistently studying over a period of time. If you go and study for an hour on Monday, but you don't come back and look at the material till next week, more likely than not, you're not going to remember anything that you looked at from last week. This is why it's important for you to set a schedule that you know that you can be consistent with. Say you set about 20 to 30 minutes a day for pharmacology, whether it's looking at flashcards, organizing and creating tables and color-coded sheets, or using mnemonics for you to remember the information in detail. Use your time wisely in order to consistently schedule time for you to review the material that you're learning in pharmacology. You want to avoid cramming the material. You can try and cram all the little facts of information into your head last minute, but I promise you it's not going to help you, especially when it comes to applying what you're learning onto the pharmacology exam, because those questions that they're going to ask you on your pharmacology exam, they're going to be a higher level of learning that they're going to ask. They're not just going to ask you what are the symptoms of the disease. You might get some questions like that, but most of the time they're going to ask you questions such as explaining the side effects of a disease in relationship to why this happens because of its mechanism of action. It can really get into detail. This is why it's so important to set a consistent schedule over a period of time. That way you're not cramming last minute. Number 7 is to leverage technology. Again, we already mentioned Anki and Quizlet, but you can use other resources online. You can use UWorld, you can use YouTube. YouTube is free. I believe Khan Academy is still free. Use your free resources. They're there to help you. Number 8 is to prioritize high yield topics. Now, when it comes to pharmacology, you're gonna be bombarded with a lot of information. What you want to do is you want to keep it simple when trying to remember the important details. Remember, know the drug name, the class, the mechanism of action, its side effects, its intended effects, its adverse effects, and that's where I usually stop. I can go further into detail about all the nitty-gritty things you should know about every drug, but that's not going to be conducive for your learning, and that's not going to be helpful for you to retain the information that you need in order to do well in your courses. Just remember those things that I just mentioned about each drug and make sure you study that. Don't go further than that, and you should be fine. Number 9 is a small tidbit, but basically it's about practicing safe drug administration. And what I mean is that you're going to have to understand and remember how to calculate your dosage calculations. The biggest tips I can give you when it comes to pharmacology math in general is to make it simple. I'm sure there's free resources such as on YouTube and again on Khan Academy. That's what I utilized to help me learn the information and to help me excel when it came to pharmacology math. The last tip I want to mention is number 10, and that is to take care of yourself. When it comes to looking at pharmacology or other difficult nursing courses, you are going to feel bogged down sometimes. Give yourself mini breaks throughout the day, such as when you're studying for 25 minutes and then give yourself those 5-minute breaks in between. That's going to help you not experience burnout. Also, make sure you're consistently getting enough sleep throughout the night, because as we know, getting enough sleep helps you consolidate the information that you've taken in through your brain throughout the day, and by doing that you're able to retain the information faster. Also, your diet is very important, because if you're not eating the right and healthy foods, you're going to feel groggy, you're going to feel tired, you're not going to be able or wanting to be motivated to study and do the work that's needed for you to excel in your pharmacology course. Ultimately, by combining understanding, memorization, and real-life application, you can effectively learn and retain the information you need in order to excel on your pharmacology exam. However, the most important thing is that even with all the things I've talked about, you need to consider your mindset. Without having a healthy and positive mindset, you're not going to be motivated to put in the work that's needed for you to excel and do well in any of your nursing school classes. I know you want the dream outcome of achieving academic success in nursing school, and I know that you probably struggle with being consistent with studying, with having lack of support, having lack of motivation, or being lost as to how to study. This is why I've created a 14-day challenge that will help you get back on track and achieve that near or perfect 4.0 GPA that you desire. If you want more information, you can click the link in the description down below for more. I hope everything I talked about in this video will help you excel and do well in pharmacology. I know it is a very difficult course, but with patience, time, and consistency, I know that you'll do very well. Thanks for watching, and I'll see you in the next one.